All right, so let's start with the big story that we're tracking on WION this morning, where doctors and scientists around the world have been studying the novel coronavirus and are trying to find a cure. There seems to be a major breakthrough in this direction. Doctors in Thailand have claimed that they may have found a curative drug for the coronavirus. The Thailand's health ministry has said that a Chinese woman who had been infected by the virus showed some dramatic signs of improvement after being treated with a mixture of antivirals. Now, these antivirals are generally used to treat flu and even HIV. In the ministry's briefing, Thai doctors have said that 71-year-old patient tested negative for the virus 48 hours after the drug was administered to her. Now, the doctors have also said that they are now awaiting the research results to prove the effectiveness of this drug.
มันเป็นยามาตรฐานที่ใช้อยู่แล้วแล้วก็มีรายงานการใช้ยานะครับส่วนยาต้านไวรัสที่รักษาโรคเอดส์ก็ทางจีนก็ใช้อยู่แต่ว่าเราไปมีการเปิดดูข้อมูลว่ามันมีรายงานว่ามีการรักษาในกลุ่มโคโรนาไวรัสในกลุ่มที่เป็นกลุ่มมือที่เคยระบาดแล้วมันได้ผลได้ยาต้านไวรัสไข้หวัดใหญ่เราก็เลยเอามาผสมกันปรากฏว่าผลดีขึ้นอย่างภายใน48ชั่วโมงดีขึ้นชัดเจนแล้วก็เชื้อจากที่เป็นบวก10วันกลายเป็นลบนะครับ
Meanwhile, the death toll from the coronavirus in China has now risen to 361, and there are a total of over 17,200 new confirmed cases globally of this novel coronavirus. The virus has spread to 25 different countries around the world. 2,829 fresh cases of this infection were reported in just the last 24 hours.
全市财政已下达防控的资金4亿1639万元，多方的采购和调集防护用品、救治药品，开辟绿色通道，保障快速通行，规范物资发放，做到进出日清日洁。目前我们全市的供水、供电、供气、供油、通信方面都能保障，粮食、蔬菜、肉蛋奶等生活必需品供应没有问题。
Meanwhile, China's state television has said that one of the 2 hospitals for the coronavirus patients in Wuhan has been completed. The hospital is expected to begin operations from today, while another health facility is expected to be ready by the 5th of February, that is day after tomorrow. Meanwhile, military staff have been deployed at the newly built hospital to combat the spread of this novel coronavirus, even as countries around the world are carrying out evacuation operations for their citizens who are stranded in Wuhan. China is interestingly flying back its citizens to the virus-hit city. Meanwhile, China continues with what it claims are necessary precautions and is carrying out public transportation disinfection.
我们这个在全省570个点位设置了这个联合地方公安交警、卫生防疫部门设置了这个防疫检查点。在这个成都市周边的放射线高速公路上，我们配合地方的防疫指挥部，重点设置了16处强制防疫检测点，做到逢车必检，不漏查一车，不漏检一人。
Now, the virus outbreak has led to the closure of cities across China, including the financial capital of Shanghai, where stores such as Apple will remain shut until at least the 9th of February. And workers remain worried as the shutdown is affecting their livelihood.
心情肯定不好啊，这么大的事是吧？不上班歇着也没有工资是吧？还是愿意上班吧，在家待着没事干。 也不能出来，是吧？吃饭也是问题吧。
Meanwhile, the mysterious coronavirus has fast spread to 4 continents and has affected well over 17,000 people. And China has been taking steps to try and control the epidemic. It's even got appreciation from the World Health Organization for its efforts in containing the virus. But the question that arises is, could the virus have been controlled more efficiently? Could China have acted earlier and faster? And did China keep the information about the mysterious virus from the world? If one were to go by a report in the New York Times, then there are certain questions that have been raised about the detection of this virus. When did China actually first become aware that there was this mystery virus that had surfaced? According to the New York Times, a Chinese doctor by name Li Wenliang had warned about a mysterious illness which had struck 7 patients at a hospital on the 30th of December in 2019. The virus at that time had not been identified, but Li Wenliang understood the danger that it reportedly posed. He tried to warn his medical school classmates in an online chat group. Wenliang wrote, and I quote, "So frightening," one recipient replied before asking about the epidemic that began in China in 2002 and ultimately had killed about 800 people. He was referring to SARS in this case, and he asked, is SARS coming again? Now, the illness is not SARS, but something similar to it. It is now called the coronavirus. The way the Chinese government has reacted to this is rather astonishing. Now, as per the report, the government tried to silence the doctor and bury the entire matter. The officials from the Health Authority of Wuhan summoned Dr. Wenliang and also demanded to know as to why he had shared this information. Wenliang was later ordered to sign a statement that read that his warning constituted quote-unquote illegal behavior. The report also goes on to state that the government's initial handling of the epidemic allowed the virus to gain a certain tenacious hold. It blames the officials for choosing secrecy over openly confronting this new viral outbreak. The report also alleges that this was done to avoid political embarrassment for China, and if the report is indeed true, then it seems like the WHO was rather early in appreciating the Chinese efforts in controlling the coronavirus. Now, the coronavirus is spread to 25 countries from outside of Wuhan. It's, of course, spread throughout China, and indeed, it has so far killed well over 300 people and has infected over 17,000 worldwide. In fact, a Hong Kong university study estimates that there could be as many as 75,000 people who could be infected in just the city of Wuhan alone. China is now doing everything that it can to try and control the outbreak. It has built a 1,000-bed hospital in a record time, and another special hospital is under construction and is expected to be completed by the 5th, that's day after tomorrow. But was there a chance to avoid all of this, to have saved more lives? Now, the report says that if the Chinese government had not tried to put a lid on the outbreak of the disease initially, then perhaps more lives could have been saved. The Chinese government was trying to save itself the embarrassment, but in turn, it has ended up putting a lot of lives at risk.